Welcome back to She Really Gets It. I'm Stefanie Rhodes, health educator and reformed public health professional. And in this week's episode, we will be discussing head lice. Why are we discussing head lice? Well, because most recently, the American Academy of Pediatrics upgraded or updated their recommendations regarding head lice. The new policy issued by the American Academy of Pediatrics, or AAP, was issued in September of 2022, and it states that children should not be sent home for a lice infestation because it is not an issue of poor hygiene or a hazard or a health hazard. According to the lead author of the report, Dawn Nolt, head lice are an unpleasant part of the human experience, but they can be successfully managed and are no reason for a child to miss school. The primary concern of the authors is stigmatization of children with lice infestations, loss of days in schools, and loss of time for parents who have to stay at home from work in order to stay with their child. So, why is this important? Why is this important for this podcast? Well, in this podcast, we want to talk about equity. We want to bring light to issues surrounding equity. The American Academy of Pediatrics have thought long and hard about the psychological well-being of children affected by head lice. The AAP report, or American Academy of Pediatrics report, further states that there is significant stigma resulting from head lice infestations in high-income countries, resulting in children and adolescents being ostracized from their schools, friends, and other social events. So, the question that I have is keeping children out of school with active lice infestations warranted? And in order to answer that question, I needed to learn more about lice. I've never had lice because they are very rare in Black people in the United States, at least. And I've never seen one like up close and personal. So I wanted to know more about head lice. What are they? How do they affect you? So what are head lice? They are a parasitic insect that can be found on the head, eyebrows, and eyelashes of people. They feed on human blood several times a day and live close to the human scalp. Infestation is most common among preschool children attending childcare, elementary age school children, and household members of those children. In the US, head lice is least common among Black people than any other race. Now, I've always heard that, and there's always that saying that Black people don't get lice. I want to make it clear that Black people can get lice. It's possible. It's just extremely rare in the US. And the reason for that is believed to be due to the fact that the claws of the head louse found most frequently in the US are not adapted to grasp the shape and the width of Black hair. One caveat being that Black people have every texture of hair known to man. So Black people with curly to kinky hair, they have a very hard time grasping our hair. And as a result, head lice are not very common, or rather are least common among Black people. So I have a lot of thoughts about this. I have a lot of thoughts about these new recommendations around head lice and specifically the fact that we're okay, the American Academy of Pediatrics is okay, or rather supporting children going to school with active parasites living on their scalp. And I don't want to stigmatize children or parents that are dealing with head lice. That's not the goal. However, I think in light of the pandemic, the last 2.5, 3 years, I wonder how much we've learned. So I think of it this way. We've had a chance during this pandemic to learn that we can work from home. Depending on your job, Children can go to school from home. You can have hybrid classrooms. We have the technology in order to do that. And I would think that especially institutions like the American Academy of Pediatrics would support setting the example of, guess what? If you are sick or you have an active infection, active infestation, stay home. Even if the chance of you transmitting that is relatively low, stay home. Why take the risk? So that's one thing, right? So head lice can't kill you. I still consider it to be a health hazard. And there are things that are more important than simply missing school. And like we all now know, you don't have to miss school, right? You have options of going to school from home. You have hybrid classrooms. And even if there are schools that are all about children going to school 5 days a week, being in the classroom, that's, to me, that says that that school district has learned very little. So while I agree about stigma and we don't want to stigmatize children, I also believe that there is something to be said about staying at home sometimes. There are times when it is perfectly okay to leave your little ass at home, especially in this case when you have an active parasite living on your scalp, feasting on your blood. I think that it's perfectly okay in that situation to stay home, to not go to the birthday party. And also considering the fact that this is something that's most common among um, preschool age children, I get it, as long as they don't touch each other's heads or share headbands or share brushes or share hats. They should be fine. But if you've ever been around preschool age children, good luck getting them to do that. So, practically speaking, if we're thinking about the role of public health professionals, of medical doctors, it's all about prevention. This just seems irresponsible to me. I think, in light of everything we've learned, in light of the pandemic, I would hope that their recommendation would be, hey, we actually recommend that schools give children the option to go to school from home, to go to school remotely in situations like head lice, because now we know that it's possible. Let's continue to utilize what we've learned, give people flexibility so that they can take the best care of themselves. Just because you can do something doesn't mean you should. When it comes to parents and parental leave, I would hope that they would make the recommendation that employers give those parents paid leave, give them extended paid leave for things like head lice. Because guess what? I don't want you sharing an office with me when you have parasites on your head, when you have head lice. I would just feel more comfortable if you stayed home. If I have to pay more out of my paycheck for you to stay home when your child has head lice, I'm okay. I'm okay with that. I don't know about the audience. Charge me. Please do. So honestly, if the AAP is a slave to capitalism, just say that. So is lice infestation stigmatizing? Sure, sure it is. I don't think it's going to be less stigmatizing when your child is going to school with lice. I think people are still going to talk. That's just a part of life. And also, let's keep it in mind that it's temporary. Your child can't go to a few birthday parties and social gatherings. So what? In the big scheme of life, that is not the end of the world. And of course, even bigger than that, than all of that, I think we have to ask ourselves, who is public health protecting? Because, like I said earlier, head lice are not something that affect Black people to the extent that it does every other group of people due to the texture of our hair, simply because of our anatomy doesn't greatly affect us. So when we're thinking about who is most affected by head lice in school, so non-Black children, and then we think about Black children, and we think about the concern of the AAP, and their concern is stigma, and their concern is days spent out of school, because they know And if you've read studies on like suspensions and the more days children are out of school, it can have a deleterious effect. It can have a very negative effect on outcomes. However, what's interesting about that is that when we're thinking about who's most likely to spend the most days out of school, it's actually Black kids, the ones that are least likely to have head lice and to be asked to stay at home as a result of head lice. Our school system greatly makes up for that. So Black kids, a few facts that I'm going to go through. Black kids are the most likely to be sent home from school for discretionary suspensions. And discretionary suspensions are basically suspensions that are not required by law. Suspensions that are required by law, examples of that would be bringing a weapon to school, threatening violence. Those are suspensions required by law. And discretionary suspensions are primarily hair and dress code violations. 70% of all suspensions in schools are discretionary. Black students are disciplined at a rate 4 times higher than white students and suspended at twice the rate of white students. Those increased suspensions actually increase the likelihood of dropping out due to poor academic performance, joining gangs, and getting arrested before the age of 21. And most of those suspensions and those days out of school are a result of discretionary suspensions. So hair and dress code violations. In fact, I'm sure if you can, anyone who's listening to this podcast could probably think of stories of Black children being suspended from school, asked to go home because they have their hair in braids. There are actual school policies on the books right here in the United States that don't allow braids, cornrows, locks, twists, anything that is considered to be too Black, essentially. So we have on one hand the AAP and honestly public health institutions being concerned about stigma related to head lice, which is honestly a decent concern, right? Like it's parasites, once again, feasting on your blood. However, we have this much bigger issue, right? A very real problem. I don't know how many the real harm that's done by staying at home because you're sick, you have an infection, those kind of things happen. That's a reasonable reason to stay at home from school, right? And I want to always set the example of yes, when you're not feeling well, or if something's going wrong with you, you're not feeling well, you're tired, you have a parasitic infection, you stay at home from school. However, I would be much more concerned, and I'm much more concerned about the stigma that comes along with the institutions that are supposed to be educating students, telling them that their hair is not acceptable as it grows out of their head. That is stigmatizing, right? That has long-term effects, not a couple, not 10 days out of school. That has long-term effects. Your hair is not acceptable as it grows out of your head. These hairstyles that are very unique to your culture are not acceptable in this space, in this place of learning. So what are head lice? Head lice are a parasitic insect that can be found on the head, eyebrows, and eyelashes of people. I didn't know it could be found on eyebrows and eyelashes. They feed on human blood several times a day and live close to the human scalp. Infestation is most common among preschool children attending childcare, elementary school children, and household members of those children. In the US, head lice is actually least common among Black people than among people of any other race. So there is some credibility to that saying that Black people don't get lice. And this is believed to be due to the fact that the claws of the head louse, found most frequently in the US, are not adapted to grasp the shape and width of Black hair. Now, I went online, I did some research, and I did learn that there were some Black moms who were like, my Black child has gotten lice before. even though it's very rare. And from what I've heard, it's not great. It's actually worse. It's much harder to find it. There are more places to hide. Um, and especially if you have styles like locks, it can be particularly treacherous. Um, so Black people can get head lice. I want you to keep that in mind. It's just extremely rare. Most of the head lice found in the US can't grasp the shape and width and texture of Black hair. It doesn't mean that all of them can't. Also, keep in mind that there are going to be like certain Black people, we have hair of every texture in our community that will be more susceptible to it just because they have a softer curl pattern, looser curl pattern, or just hair that's naturally straight. So I want you to keep a few things in mind. The fact that, of course, I want you to keep a few things in mind. The AAP's recommendation, and of course, their concern about, psychological stress on children, stigmatization of children, and the fact that we're going to talk about which students are suspended the most. And I'll give you a hint, it's not the white students. We think about suspensions and times off from school. Who should we really be concerned about? Who should we really be putting all of our energy into protecting, or more energy into protecting? And who does public health really aim to protect? So my first thoughts when I hear this, when I think about their recommendation that students can continue to go to school with head lice, with a parasitic insect essentially living on their head. My thoughts are, what have we learned from this pandemic? What I learned during this pandemic is that there is so much room for flexibility in the workspace, in the education space. We have the power to include so many different people of different ability statuses, so many people with different needs based on responsibilities at home, due to illness, due to chronic disease. We have all of this flexibility. So I find it odd that at this particular time, the AAP would recommend that students can continue to go to school with head lice, with a parasite living on their body, if it's not absolutely necessary to do so. And while it's possible for that child to go to school and not spread that, why take the chance? Especially if they can do their schoolwork from home, go to a virtual classroom. When I think about what I would hope the AAP's recommendation would be, I would have hoped that it would have been something that takes into account everything we've learned over the past few years when it comes to safety, when it comes to public health, when it comes to the flexibilities that we can make to be very inclusive. That child can still go to school, they can still learn, it's not impeding their learning. Great. Okay. Well, then in order to stop the spread, essentially, prevent it at all costs, because guess what? I've never had head lice, but I can't imagine that it's a pleasant feeling. And if we're concerned about stigmatization, exclusion, that's not going to change just because the child is continuing to go to school with head lice. Okay? So when I think about what we have learned, or what I've learned, I'm looking at some of the recommendations from institutions like AAP overall. There seems to be this rush to get back to normal, to put us back in situations that aren't necessarily the best for our overall health. And I think this would have been honestly a great opportunity to instead say, you know what, if children have head lice, we don't want to stigmatize them, but guess what? We don't have to. They can continue to go to school. They can do so virtually. We recommend schools have that option for them. For parents of children that have head lice, we recommend that there be, accommodations made by employers to allow those children, those workers, when they can, to either work from home, right? Because that's possible with certain jobs. And if it's a job where that's not possible, always have, paid leave for those parents. Because I don't know about you, but I prefer that my coworker stay at home if they have head lice, and if their child has head lice, that's what I would prefer. I don't know about you, and if I were to employ someone, I would love it if they would just stay at home if they had head lice. That's what I would prefer. It's okay to stay home. I think taking a break from social activities when you have an active parasitic infestation, just that's a good example, but that's just me. If the AAP is a slave to capitalism, just say that. So is lice infestation stigmatizing? Sure, sure. Yes, yes, you have actual parasites crawling around on your head. However, it's temporary. And guess what? You can't protect children from all discomfort. You can't protect them from all bullying and teasing. Not all of it. Not all of it. Your child can't go to a few birthday parties or social gatherings. Not to be rude, not to be harsh, but honestly, so what? It's okay. Life will go on. And of course, even bigger than all of that, I think we have to ask ourselves, who is public health actually protecting? And since the AAP brought it up, let's talk about time off from school. Let's talk about suspensions. Let's talk about being asked to stay home and the impact of that, and actually who's being most impacted by being forced to stay home from school. And so first, what we're going to talk about discretionary suspensions. So discretionary suspensions are essentially suspensions that are not required by law. 70% of all suspensions in schools are discretionary. And Black kids are most affected by discretionary suspensions. And the most common discretionary suspensions are dress code violations and hair violations. And guess what? Head lice, the parasitic infestation of the hair, is not considered to be a hair violation. Examples of hair violations that I found when I started looking them up: braids, twists, locks, or hair that is deemed to be distracting. Now, increased suspensions, 70% of suspensions are discretionary, so hair and dress code. And oh, wait, Black students are suspended at twice the rate of white students. So they are really getting the hint of these suspensions. These increased suspensions, increase the likelihood of dropping out due to poor academic performance, joining gangs, and getting arrested before the age of 21. So, on one hand, we have the American Academy of Pediatrics that's concerned about primarily non-Black children being excluded from events due to having blood-sucking parasites feasting on their scalp. And on the other hand, we have Black students who are largely unaffected by head lice, but are greatly affected by discriminatory policies, which leads to discretionary suspensions regarding whether their hair, as it normally grows out of their head, or how it is styled based on culture, being truly harmed by suspensions and time off from school because they spend the most time out of school due to discretionary policies, primarily around hair and dress code. In fact, some schools have actual bans on hairstyles, such as braid, locks, twists, afros, and of course, distracting hair. From what I read, usually anything that is considered a natural hairstyle for people of African descent. Not parasite infested hair, distracting hair. And let me repeat, increased suspensions increases the likelihood of dropping out due to poor academic performance, joining gangs, and getting arrested before the age of 21. Not stigma, not feeling a little bad about yourself, not being excluded from a birthday party. So when I think about this, it actually reminds me of a passage from, and correct me if I'm mispronouncing her name. I always feel like I am. Lonnie Guinier's book. It's called The Tyranny of the Meritocracy. And in it, she mentions a law review article written by professors Robert Paul Wolff and Tobias Barrington Wolff. In the article, they describe an imaginary island called Inversia. One of Inversia's preeminent national institutions is a world-class hospital. At this hospital, on a random day, two patients come into the hospital's emergency room, or ER. One patient is suffering from a heart attack, and the other has a pimple on his nose. In Inversia, the imaginary island, the hospital staff leaves the heart attack victim to die, and instead they turn their attention to what the authors describe as a tall, tanned man who they call an Adonis. She equates the hospital's treatment of the two patients to that of our university admissions process, which is more concerned with taking in a class full of Adonises rather than those who are in the most critical need of an education. Once again, this begs the question, who does public health protect? Instead of being focused on the mission of educating systems, it rewards wealth and privilege with more wealth and privilege. And now, here we are in the case of the AAP, the American Academy of Pediatrics, and head lice. They are more concerned with protecting certain children, and in this case, non-Black children, from being excluded from a few events, from days of school, for an actual living parasite feasting on the blood of their scalp. They don't want them to feel excluded during this relatively short period of time. Meanwhile, we have an actual problem when it comes to Black children and being excluded because of how they present to the world, being excluded by the very institutions that are set to educate them based on their hair, based on their hair texture, based on their very existence being distracting. So once again, this begs the question, who does public health protect? Well, that's the end of the show. Thanks for listening in. Please write in about any questions, comments, or concerns. And if you think you really get it, send in some answers. Be sure to follow She Really Gets It on YouTube, Spotify, Amazon Music, and wherever else podcasts are found.